Hello everyone, my name is Cindy Liu.
And my name is Xian Li, and this podcast is brought to you by the Pennsylvania Healthcare Benefit Solutions Program as part of its Understanding Medicare series.
PHBSP is a nonprofit service agency that helps people navigate through the complexities of programs like Medicare and Medicaid and the private health insurance marketplaces. We provide individual counseling and patient advocacy services. We also produce community education presentations like the one you're watching now.
So, in today's podcast, we're going to be discussing the limitations that Medicare Part D imposes on accessing prescription medications and the problems faced by individuals as a result. Then, we will discuss the programs and resources available to help with this.
To start off, we are going to do a brief overview of Medicare Part D and all that it entails.
Medicare Part D is the prescription drug coverage offered for those in Medicare. It is optional and helps lower the cost of prescription drugs.
It is similar to private insurance in the sense that there is a monthly premium along with a deductible.
In addition to the standard Medicare Part D plans, there are also supplemental programs which can provide additional help to cover the costs for monthly premiums and for drugs that may still be expensive after coverage.
Today, we will be going into more detail on the eligibility and logistics for PACE, PACENet, and LIS, but there are more supplemental programs which we will not hit on today. Now, we will dive into some limitations of Medicare Part D. First off, there are formulary restrictions in Part D plans. Sometimes, certain medications may not be covered by the plan you are enrolled in. When enrolling, you always want to make sure that the plan will cover as many of the medications as you need. However, sometimes it is just not feasible because of the plan, or you may get started on a new medication that won't be covered.
When medications are not covered, you may have to pay the full cost of the medication out of pocket, or you may need to look at alternative therapies. Another limitation is the difference in how much your medication costs based on each plan. For example, one plan may cost $1 for your medication, but in another Part D plan, it may cost $50. It is important to compare plans and find the one that best suits your specific medication needs.
One of the biggest limitations with the Part D plan is the coverage gap and catastrophic coverage.
Within Part D, there are different phases of coverage, resulting in differences in payment. To start off, you have to meet your plan's deductible. This is the bottom of the chart where the star is. After that has been met, you will have initial coverage, which is the next part on this chart. This is essentially normal coverage, where you divide the cost of the drug between you and your insurance company. The insurance company typically pays a greater percentage of the drug.
However, after this initial coverage is where Part D gets a bit tricky. Once you reach a certain dollar amount, for 2024, that is $5,030, spent between you and what your insurance pays, you will have reached your initial coverage limit. Then you fall into the coverage gap. That is the next tier where the star is now. This basically means that you will be responsible for covering a higher percentage of the drug cost, the rest of which is shared with the federal government until your cost reaches the out-of-pocket limit. For 2024, that out-of-pocket limit is $8,000. Then you will reach the last phase, catastrophic coverage. Catastrophic coverage is the last phase where you have exhausted every limit, and you would pay $0 for the drugs covered on your formulary. These limits are specific to 2024 and may change next year.
The issue with the coverage gap is that it can get quite pricey having to pay for a large percent of your drug out of pocket. Thankfully, some of the programs we will talk about today can help with this.
Lastly, another huge limitation of Part D plans are prior authorizations in step therapy. Part D often requires prior authorizations, especially for costly medications.
What this means is that even if your drugs are on formulary, you may need to get your doctor to advocate as to why you need this particular medication to justify the cost. This can be a lengthy and time-consuming process.
An even more extreme version of this is step therapy. This is where you may have to try out the cheaper drugs available for your condition first to prove that they are ineffective before the more expensive medications will be covered.
Both of these are time-consuming and inconvenient, especially if a medication is needed immediately. To help this, we will be discussing ways to obtain medications at a reasonable price outside of Part D.
To start off on our discussion about supplemental programs to help cover the costly limitations of Part D, we will be talking about LIS, which stands for Low Income Subsidy Program, also known as the Extra Help Program.
This program helps with issues regarding medication price variance and coverage gaps, which we talked about earlier. This program helps cover the costs of normal insurance payments, such as premiums and deductibles. In addition, the program offers benefits for co-payments.
Outside of paying $0 for your plan premium and deductible, all generic drugs are $4.50 or less, and all brand name drugs are $11.20 or less. This can be especially helpful when you reach your coverage gap, because no matter what, you will not be paying more than $11.20 for a drug.
While LIS can significantly decrease the costs associated with Part D, there are eligibility requirements based on your income and resources. But if you're enrolled in Medicaid, you're automatically eligible regardless of your specific income and resource amounts.
The income requirements vary based on whether or not you are married. We have both the income limits as well as the resource limits listed here. What is classified within your resource limits includes money you have in the bank, along with your retirement account, and other stocks and bonds you may have.
It is important to note that the value of your home, car, household, or personal items, and up to $1,500 for burial expenses outside of the cost of your burial plot does not count towards this resource limit. You may be eligible even if you don't think so right off the bat. Also, it is important to note that these income and asset requirements do not apply for those enrolled in Medicaid, as you are automatically eligible for LIS.
To apply for this program, you can go to your local Social Security office to apply. Or, if you feel more comfortable applying at home, you can apply online on the Social Security office's website or by calling them for assistance.
On the online application, there is also a form to check if you qualify for LIS. This can be useful because you may at least qualify for partial LIS, even if you don't qualify for full coverage.
Next, we will discuss another supplemental program called PACE. This program is only available to PA residents and should not be confused with the federal Medicare program, also called PACE. I know, it is a little bit confusing, but if you look this up on your own time, make sure you are on a pa.gov website and not on medicare.gov.
Now, to jump into it, similar to LIS, PACE also helps individuals in a coverage gap. For a 30-day supply, your maximum copayment is $6 for generic drugs and $9 for brand name drugs. In addition, PACE pays for your Part D premium as well. This price cap makes medications significantly cheaper during coverage gaps.
As I said earlier, this program is only available for PA residents, specifically those that have been here for at least 90 days. In addition to that, you must be 65 or older and meet the income requirements. For single individuals, your income must be $14,500 per year or less, and for married couples, the total income must be $17,700 per year or less. It is important to note that some individuals in Medicare won't be eligible for PACE. Those that are in Medicare based on disability or end-stage renal and under 65 years of age will not be eligible.
To enroll in PACE, you can complete this application online, call to enroll, or you can even mail in a paper application via fax or email.
Similar to the PACE program, another program for PA residents is PACEnet. This program has almost entirely the same benefits as PACE, but it has more relaxed income requirements, so more people may be eligible.
Since the income requirements accommodate those that make slightly higher, the maximum copay for a 30-day supply are also a bit higher. For a generic drug, you would pay a maximum of $8. For a brand name drug, you would pay a maximum of $15. However, PaceNet does not pay for the Part D premium the way PACE does. PaceNet can be used without a Part D plan, so if you do not have a Part D plan, there will be a monthly PaceNet premium of $40.16 for the 2024 year. However, there are Part D plans that are less than $40.16, which you can enroll in and avoid paying the PaceNet monthly premium.
PACE and PaceNet have the same application process. You can download the application and mail it, fax it, or email it to the appropriate office. Or you can complete the application online through the online portal. The upper left picture is what a PACE card looks like. You should bring this card to the pharmacy with you when you go pick up your prescriptions.
Now, everything we have talked about so far has been in conjunction with your Medicare Part D plan and helps well in a coverage gap or when a medication is just too expensive while using Part D. However, there are also instances where it may be necessary to bypass Part D entirely.
Some instances where we might want to bypass Part D are when the medication is not in the formulary, Part D denies coverage, or when a medication is more expensive using Part D as compared to some of the drug coupons available.
Another instance is if you need to go through prior authorization, but you need the drug immediately. Then, you may choose to bypass Part D temporarily until you can get coverage. Or, in some instances, Part D will want you to do step therapy, but you want the drug your doctor is recommending.
In the case of any of these scenarios, this is when you seek out alternatives such as GoodRx or Cost Plus drugs. While these are certainly viable options in the specific circumstances we mentioned, it is important to note that none of these replace your Part D plan. It is important to remain under Part D coverage because you never know what the future holds or when that additional Part D coverage may be necessary.
The first alternative to Part D we'll be looking at is GoodRx. This is a website that can help you find the best price for your medications without using insurance. It does this by finding you discounts, coupons, loyalty programs, or savings cards to use for specific medications.
Some benefits of GoodRx are that it can genuinely find you a cheaper price for your medications compared to the base out-of-pocket price, and there is no membership fee. GoodRx does offer a paid service, but it is absolutely not necessary.
To use GoodRx, you must go to goodrx.com. Search for your medication in the search bar, as seen in the picture on the slide. Then, hit the blue button titled Find the Lowest Price. You then want to specify your location by clicking the map pinpoint logo and typing in your zip code as seen on the screen. This is so you only see the pharmacies in your local area. It will then pull up the prices at different pharmacies, and you can choose which price or pharmacy you like the best.
It is important to note that for GoodRx, it is very pharmacy dependent. For example, if a coupon is listed for a Walgreens, you have to go to Walgreens. Otherwise, you may not get the same deal.
Yes, make sure you go to the pharmacy for whose coupon you choose. Now, once you get to the pharmacy, you will tell the pharmacy staff that you are using a GoodRx card, and you will have to provide them with the BIN, PCN, group, and member ID listed on the coupon.
Another option to bypass Part D is a program called Cost Plus Drugs. This differs from GoodRx because it is an online pharmacy, so they will mail you the drugs. You do not go to any physical store, and the price that they have listed is the price that Cost Plus Drugs set.
Some benefits of Cost Plus Drugs is that they offer a wide variety of medications for many indications. Like GoodRx, most of these coupons apply to generic medications, including medications for oncology, HIV, or chronic illness management, which can retail over $1,000. This may be a much cheaper option for the very expensive generic drugs that Part D may not cover. However, It is not a guarantee they will offer the medication, so it is important to check on their website.
To use this service, you will first have to see if the medication you need is offered on their website. To do this, go to costplusdrugs.com and search for the medication. If it is offered, it will show up in the search results. Then, your doctor will have to send Cost Plus Drugs the prescription for your medications. You cannot send them the prescription, so you will need to discuss with your doctor that you would like to get your medications through Cost Plus Drugs, and they can sort it out from there.
Both GoodRx and Cost Plus Drugs are great options for when you need to bypass Part D. GoodRx is great for when you need to temporarily bypass Part D while you're on waiting for coverage, or if you need to pick up your medication immediately at a local pharmacy.
On the other hand, Cost Plus Drugs is useful for when you need to consistently bypass Part D for your medications, or if you like the convenience of medications being shipped directly to your house. To summarize, we have looked at the impact of the limitations for people obtaining their prescription medications through Medicare Part D, and we have looked at the resources available to help in accessing prescription medications. Today, we have generally covered the topics as outlined. We know this is very overwhelming, and it is not a comprehensive list of options. Feel free to reach out to our program for more detailed explanations and for any questions that you may have.
We hoped you learned a lot about what options are available to you to get your medications for a lower price.
If you would like to know more about our program and access our other podcasts, please visit our website at phbsp.org. And please, feel free to reach out to us if you have any questions or concerns about your healthcare issues.
You can also reach us by calling 412-266-8322 or by visiting our website and leaving a message on our contact page. Thank you so much for listening and have a great day.